Pharmacology, the cardiovascular system. Atherosclerosis. Arteriosclerosis begins with injury to the endothelium of an artery, which may be caused by irritation from high blood glucose, infection, tobacco use, excessive blood lipids, and other factors. Injured artery walls causes inflammation. As inflammation spreads to the artery wall, it weakens and scars it, leaving it stiff. Circulating triglycerides with cholesterol can seep between the damaged lining cells and become trapped within the artery wall, where they are joined by leukocytes, calcium, and cellular debris. Eventually, this buildup, called plaque, can narrow arteries through enough to impair blood flow. The term for this condition, atherosclerosis, describes the plaque deposits. Atherosclerosis. Sometimes a plaque can rupture, causing microscopic tears in the artery wall that allow blood to leak into the tissue on the other side. When this happens, platelets rush to the site to clot the blood. This clot can further obstruct the artery and, if it occurs in a coronary or cerebral artery, cause a sudden heart attack or stroke. Alternatively, plaque can also break off and travel through the bloodstream as an embolus until it blocks a more distant, smaller artery. Even without total blockage, narrow vessels lead to ischemia, reduce blood flow to the tissue region downstream of the narrowed vessels. Ischemia can lead to hypoxia, decreased supply of oxygen to the tissues, causing a myocardial infarction or cerebrovascular accident. Treatment of atherosclerosis includes lifestyle changes such as weight loss, smoking cessation, regular exercise, and adoption of a diet low in sodium and saturated fats. Antilipemic medications such as atorvastatin are prescribed to reduce cholesterol and help prevent atherosclerosis. Coronary artery disease. Coronary artery disease is the leading cause of death worldwide. It occurs when atherosclerosis within the walls of the coronary arteries obstructs blood flow. As the coronary blood vessels become blocked with plaque, the flow of blood to the tissues is restricted, causing the cardiac cells to receive insufficient amounts of oxygen, which can cause pain called angina. Blockage of coronary arteries is highlighted. Some individuals with coronary artery disease report pain radiating from the chest called angina, but others, especially women, may remain asymptomatic or have alternative symptoms of neck, jaw, shoulder, upper back, or abdominal pain. If untreated, coronary artery disease can lead to a myocardial infarction or heart attack. Risk factors include smoking, family history, hypertension, obesity, diabetes, lack of exercise, stress, and hyperlipidemia. Treatments may include medication, changes to diet and exercise, a coronary angioplasty with a balloon catheter, insertion of a stent, or coronary bypass procedure. The image of blocked coronary arteries is highlighted by the injection of a dye during a coronary angiogram. Myocardial infarction. Myocardial infarction, or MI, is the medical term for what is commonly referred to as a heart attack. It results from a lack of blood flow and oxygen to a region of the heart, resulting in death of the cardiac muscle cells. An MI often occurs when a coronary artery is blocked by the buildup of atherosclerotic plaque and becomes a thrombus, or when a portion of an unstable atherosclerotic plaque travels through the coronary arterial system and lodges in one of the smaller vessels. In the case of acute MI, there is often sudden pain beneath the sternum or retrosternal pain called angina, often radiating down the left arm in male patients, but not as commonly in female patients. In addition, patients typically present with difficulty breathing and shortness of breath, also known as dyspnea, irregular heartbeat, palpitations, nausea and vomiting, sweating or diaphoresis, anxiety, and fainting or syncope. Although not all of these symptoms may be present, many of the symptoms are shared with other medical conditions, including anxiety attacks and simple indigestion, so accurate diagnosis is critical for survival. An MI can be confirmed by examining the patient's ECG, which frequently reveals alterations in the ST and Q components. Immediate treatments for MI are required and include administering supplemental oxygen, aspirin, and nitroglycerin. Longer-term treatments may include injections of thrombolytic agents, such as TPA that dissolve the clot, along with the anticoagulant heparin, a balloon angioplasty with stents to open blocked vessels, or bypass surgery to allow blood to pass around the site of blockage. Male patients often describe chest pain associated with MI like something is sitting on my chest, but female patients may simply have feelings of GI upset. Cerebrovascular accident, or CVA. The internal carotid arteries, along with the vertebral arteries, are the two primary suppliers of blood to the human brain. Given the central role and vital importance of the brain to life, it is critical that blood supply to this organ remains uninterrupted. However, blood flow may become obstructed due to atherosclerosis or an emboli that has traveled from elsewhere in the blood. For example, an arrhythmia called atrial fibrillation can cause clots to form in the heart that then move to the brain. When blood flow is interrupted, even for just a few seconds, a transient ischemic attack, TIA, or mini-stroke may occur, resulting in loss of consciousness or temporary loss of neurological function. Loss of blood flow for longer periods produce irreversible brain damage or a stroke, also called a cerebrovascular accident. There are two types of cerebrovascular accidents, ischemia and hemorrhagic. Ischemic strokes are caused by atherosclerosis or a blood clot that blocks the flow of blood to the brain. 80% of strokes are ischemic. Hemorrhagic strokes are caused by a blood vessel that ruptures and bleeds into the brain. Risk factors for a stroke include smoking, high blood pressure, and cardiac arrhythmias. Treatment of a stroke depends on the cause. Ischemic strokes are treated with thrombolytic medications, such as TPA, to dissolve the clot, whereas hemorrhagic strokes often require surgery to stop the bleeding. Loss of blood flow for longer periods produce irreversible brain damage or a stroke, Also called cerebrovascular accident. There are two types of accidents, ischemic and hemorrhagic.